Hey everyone, welcome back to my channel at Positive Bluebird. I just got back from the cardiologist. This was my second time in the past 2 weeks, and they fitted me for a heart monitor that looks like this. Oh, I'm doing my best to be discreet. Let me turn the camera down. But that's what it looks like. It goes across your left side. And there are 3 compartments, and I'm going to show you that. Alright, so it is from LifeWatch. It's a mobile cardiac telemetry 1-lead patch, and there are several in here. I'm supposed to wear it for 7 full days until the alarm goes off to change the battery. And I believe they told me about 21 days is how long I'm supposed to wear these for. So there are individual patches, and he said that there are 4 steps. So you follow the steps on what you're doing and how to peel it off and all that other stuff. And then in here is a compartment that is holding the little blue thing. I don't know if it's on here. Yeah, there's the little blue triangle. This comes out, and then I guess you put it in each one. So when this goes off in 7 days, that means that it's running low and you need to put it in here. He said that I cannot open these until it is time, because they, if you open it in advance, the air is activating this. Okay, so, and then that's when that little blue battery comes in. So, I'm trying to remember, peel label to remove the blue chip. Okay, so yeah, so it's a blue chip, and I guess it's just being, what do you call it? Almost like charged through the whole device. And then, you know, when it's done, then you pull it out and you put it in the new one. What it's doing is it is reading everything that's going on with my body right now. Anywhere from heartbeats, body movement, breathing, the way you're breathing, if your heart is pausing, if it's racing, if you're stressed out, if you're getting ready to pass out, all of that. Then what happens is you're supposed to wear this device, which is the cell phone, through LifeWatch. I'm going to pull it out of the case here carefully. Now I'm not going to activate anything, okay? It's just a regular phone. But this is what it looks like. Okay, I'm supposed to hit record event if it's kind of urgent. So he said, for instance, since I fainted last year due to a severe leg cramp and I jumped out of bed too quickly or whatever, right? And lately, for the last 2 to 3 weeks, I've been getting up with ankle cramps that are pretty severe, and I'm close to passing out again, even though I'm not all the way passing out. He said if that happens, click on that button, pull the screen up, click on get started or whatever. What does it say? Record event. And then it'll drop down like 5 categories. Then you're supposed to tell them what exactly is going on. So the categories would be severe chest pain, can't breathe, going to faint, and I think there's a 911 dial on there, and then there was something else. So you do that, and then it will quickly send a signal to the nurse at LifeWatch, and it will send this signal to him or her, and they look at the activity right away, versus letting this device record every second for the next, week, and then, I put on the new one. If it's an urgent matter, they will jump on the computer, they will log in your name, and then they will watch to see what the heck is going on. Then they call you on this phone. They ask you what's going on, what is your activity, are you sitting down, Do you need 911? You know, all of that stuff. They'll walk you through it. They will also make the determination based off of your health history and the arrhythmic pattern, all of that stuff of what's going on through the device and on the computer. They will say, hey, you're having a mild heart attack, or hey, your heart is showing you're not getting enough oxygen to the heart, the brain. I'm going to call an ENT for you. Get on the bed quickly. You know what I mean? So it's an interaction between you and LifeWatch. It is heavy. You're supposed to clamp it on the outside of your pants or run your belt through it. I was thinking maybe I'll use my son's belt and just put it over my shirt. I don't care what I look like. Putting it under my shirt looks a little suspicious. But if I put it over my shirt, people are probably going to think I'm on house arrest, but whatever. So yeah, so that's basically what you're supposed to do. There's some little patches in here to, it's like rubbing alcohol, so you have to clean the area, put the patch on, press each section. There's 3, so you have to push this down for 30 seconds, then the middle, then this, and then all together. And then I think this is just gauze. Maybe to wipe it clean, I'm not sure. It is waterproof except for the hot tub and a swimming pool. I don't do either, so I'm cool. Oh, and you cannot take a bath, but you can take a shower and it should be fine. Like, obviously you don't want to take an hour-long shower, but, so, yeah. So there's enough that will last a week each. Now, if something is happening while I'm wearing the patch that I'm stressed out, let's say the dog starts barking at somebody knocking at my door and I'm not expecting it, it's going to record what's happening to my heart. It's going to record my breathing movement, everything that I am doing through the whole body, blood, circulation, everything, which is awesome. Now, back in the day when my son was a lot younger, I think he was 7 or 8, is when I first started wearing the monitor, but it was like a little box. And then there was tubes that you would put under your shirt and you would just clamp them on your chest. And then I believe it would make an alarm if you needed to stop what you were doing. You unhooked the device, and then I think we put it to the landline. And the box would, or yeah, the little box and the landline would make this obnoxious, like AOL old school noise, or a fax machine noise. Yeah, the guy that was doing my monitor today, he goes, oh my God, that's really old school. So, but he said you do not need to do anything with this new device. If, you know, the dog is freaking me out because he's barking so much, or somebody's pounding on my door, or whatever may be happening that's pretty severe or elevated, that's when the LifeWatch person will call me on this phone, ask again what the activity is, what's going on, where you at, and then they make the determination from there by reading what this is sending to their computer. And then they can say, hey, you're having a small heart attack, we're going to call 911. Or, hey, your blood pressure or whatever seems to be elevated, please sit down and relax, put your feet up, ignore the people at your door, whatever, right? So yeah, and then she said, or he said, if the alarm goes off, that just means that the battery needs to be fixed, on here. But for this, not fixed, switched into here. But they will call me directly on here if there is something that I need to do. So that is the little review, you guys, of LifeWatch. I am not getting paid for this. I'm not putting a paid advertisement for it either. This is just something that they gave to me. Not every monitor is alike. So if you think that you need to have a monitor, again, you may not get this one. It is what your doctor is recommending, what brand, what type. But I am not advertising this. This is just something that is connected for my health today and for the coming days. So, all right, guys, that was my little mini review. I am getting ready to go live pretty soon. I'm probably going to do some crafting and just chit-chatting. It's Throwback Thursday, and I think we should do some storytelling or something. Let's just have some fun. Okay, so we're just going to ignore that this is on. We're going to do our best just to have some fun, and life goes on, right? Peace out and stay positive, and see you soon, guys.